Most people ignore bloating until it's too late. But here's what doctors actually see in the ER that you need to know right now. I'm going to show you the difference between normal bloating and the warning signs that could save your life. And trust me, by the end of this video, you'll know exactly when to worry and when to relax.
Let's start with what's actually happening inside your body when you bloat. Your digestive system is essentially a 30-foot-long tube with trillions of bacteria working 24/7. When you eat, swallow air, or those bacteria ferment food, gas builds up. This is completely normal. Your body produces between 1 to 4 pints of gas every single day. Most people pass gas 14 to 23 times daily, whether they realize it or not. That slight tightness after a big meal? That's just your stomach doing its job, stretching to accommodate food and the natural fermentation process happening in your gut.
But here's where it gets interesting. Normal bloating has a pattern. It comes and goes. You wake up with a flat stomach, eat throughout the day, feel progressively fuller, and by evening you're a bit puffy. Then overnight, everything resets. This is your body's natural rhythm. The bloating responds to what you eat. Beans, cruciferous vegetables like broccoli and cauliflower, carbonated drinks, eating too quickly, these are known gas producers. If you can connect your bloating to specific foods or behaviors, that's actually a good sign. It means your system is predictable and functioning normally.
Now let's talk about what's not normal, because this is critical. If your bloating is persistent and doesn't improve overnight or after a bowel movement, pay attention. If you're waking up already bloated before you've eaten anything, that's your body sending a signal. Progressive bloating that gets worse week after week, where your pants that fit last month now don't button. That's not just about diet anymore. And here's the red flag everyone needs to know. If bloating comes with unexpected weight loss, that's an immediate doctor visit. Your body doesn't lose weight and bloat at the same time under normal circumstances.
Let me explain some specific conditions that cause problematic bloating. SIBO, or small intestinal bacterial overgrowth, is when bacteria that should stay in your large intestine migrate up into your small intestine. These bacteria ferment food prematurely, creating excessive gas and bloating within 30 minutes to 2 hours after eating. People with SIBO often describe feeling like they're 6 months pregnant after a normal meal. The bloating is severe, uncomfortable, and doesn't match the amount of food consumed.
Food intolerances are another major culprit, and they're different from allergies. Lactose intolerance affects about 65% of the global population to some degree. When you lack the enzyme to break down milk sugar, it sits in your gut and ferments, causing significant bloating, gas, and often diarrhea. Gluten sensitivity and FODMAP intolerances work similarly. These aren't life-threatening, but they dramatically impact quality of life. The key identifier is consistency. The same foods trigger the same symptoms every time.
IBS, or irritable bowel syndrome, affects the gut-brain connection. Your intestines have more nerve cells than your spinal cord, and when these nerves become hypersensitive, normal amounts of gas feel painful. The muscles contract irregularly, trapping gas in certain areas. People with IBS often experience bloating that shifts location throughout the day, accompanied by cramping and alternating constipation and diarrhea. Stress and anxiety make it significantly worse because your gut and brain are in constant communication.
Now for the serious stuff you absolutely cannot ignore. Ovarian cancer often presents with persistent bloating as an early symptom. Women sometimes dismiss this for months, thinking it's just middle-age weight gain or digestive issues. But ovarian cancer bloating is relentless. It doesn't come and go with meals. It's often accompanied by pelvic pain, feeling full quickly when eating, and urinary urgency. If you're a woman experiencing these symptoms for more than 2 weeks, get checked immediately. Early detection is everything with ovarian cancer.
Ascites is fluid accumulation in your abdominal cavity, usually indicating liver disease, heart failure, or cancer. This isn't gas, it's actual fluid. Your abdomen swells significantly, becomes hard and distended, and you might notice your belly button pushing outward. This develops over days to weeks and progressively worsens.
It's often accompanied by swelling in your legs and shortness of breath when lying flat.
Bowel obstruction is a medical emergency. Whether from tumors, scar tissue, or hernias, when your intestine becomes blocked, the bloating is severe and painful. You'll have absolute constipation, nothing passes, not even gas. The pain is cramping and comes in waves. You may vomit, and that vomit might even smell fecal if the obstruction is complete. This requires immediate emergency care.
So when do you actually need to see a doctor? Use this checklist. Blood in your stool, whether bright red or dark and tarry, always warrants investigation. Persistent bloating lasting more than 3 weeks that doesn't respond to dietary changes needs evaluation. Unintentional weight loss of more than 5% of your body weight combined with bloating is a red flag. Severe pain that doubles you over or wakes you from sleep isn't normal bloating. Fever with bloating suggests infection or inflammation. Changes in bowel habits lasting more than a few weeks, new constipation, diarrhea, or alternating between both need assessment. And if you're over 50 with new bloating symptoms you've never had before, especially with a family history of colon or ovarian cancer, don't wait.
For normal bloating, there are effective strategies. Eat slowly and chew thoroughly. You swallow less air. Avoid carbonated beverages and drinking through straws. Identify your trigger foods through an elimination diet. Increase physical activity, which helps move gas through your system. Probiotics can help balance gut bacteria, though results vary by person. Over-the-counter simethicone breaks down gas bubbles and provides relief for many people. And manage stress, because the gut-brain connection is powerful.
The bottom line is this: bloating is incredibly common, and most of the time it's benign. But your body communicates through symptoms, and bloating with red flags is your body screaming for attention. Trust your instincts. You know your body better than anyone. If something feels different or wrong, if the bloating pattern changes, if it's affecting your quality of life, seek medical evaluation. A simple exam, some blood work, and maybe an ultrasound or CT scan can provide enormous peace of mind or catch something serious early when it's most treatable.